All right, we're going to do some combination of sports and deep tissue in the lower extremities. For right now, I'm just going to do anterior side. Okay. So whether this is if this is a pre-event, remember everything is nice and quick, light. There's no deep work in pre-event massage. We're trying to get this athlete ready to take part in whatever it is he's going to do. Okay. So flexion, extension, rotation of the major joints. Okay. Got some flexion and extension in the knee and in the hip. Bend. Okay. Nice and slow, or nice and fast, nice and light, just getting blood flowing. Okay. Now, if this is post-event, I'll go a little bit slower and do more compression, trying to help him get rid of some of the inflammation that he has caused by the heavy exercise, whatever the event is. Okay. Most people will tell you to compress towards the heart. It's also easy to think about these big lymph nodes in here. They're like drain sewers or storm gutters. That's where you want to push all of the lymph up into the nodes so that the lymphatic system can take it. And remember, the lymphatic system doesn't have a heart. It doesn't have a pump like the heart does for the circulatory system. Lymph is moved through the body by the contraction of muscle. So if we're going to do maintenance sports massage, we're going to use a lot of deep tissue work. Okay. Maintenance means we're trying to keep the athlete at a high level, or we move into rehab, and a lot of times they kind of bleed into each other. Okay. I like movement. I like, whether I'm doing deep tissue or sports, I like to see joints move. Okay. So if I get any pain response, or if his leg suddenly gets really heavy and he's resisting me, I'm going to stop. I want to go inside, outside, up, down. You can even get creative and add rotation when you're at a deep flex. You can just kind of play with it, see what the body will tell you. Okay. So I kind of hit a wall here with this adduction. So that might be adductors, or it might be a tight IT band. It's one or the other. I like active deep tissue. So what I'm going to ask him to do is extend all the way up to the top and then very slowly come down. And as he does that, I'm going to strip this quad. Come up as far as you can. Down nice and slowly. Okay, notice my body mechanics. My weight is right over the top of my work. I'm not extending away from my body. Everything is nice and close. Okay, I get a lot of palpation with my elbows because I've been doing this a long time. I highly recommend you train yourself to get that. Take some of the wear and tear off your hands doing all the palpation work. Okay, so that's just a spot that's telling me you could use some work, you could use some love. Deep tissue, stretch, or stripping. This is also pin and stretch. This is him being passive. Lift your leg up. That's him being active. Okay, remember that everything is from the client's perspective, not ours. If I'm doing the work, it's passive. If he's doing the work, it's active. Okay, adductors. Remember what your boundaries are, right? Sometimes I will plant a hand like that so I know, he knows and I know that I don't go any further than that. Okay, so that's my contract with him. And again, that's just acting as a barrier. You can always ask the client to do it for you. Have them put their hand right in their groin and hold on to their genitals so that you don't hit them, right? There's nothing wrong with asking a client to do that. It might be awkward, might seem weird, but there is no harm in doing that, okay? Quads, adductors, patellar tendon is always a good spot for work. That way you get all four heads of the quads if you're working on the tendinous attachment. Medial, lateral, right? Slow and deep, not painful. Tibialis anterior, peroneals, all of the dorsiflexors, okay? Again, sports massage would be quick, or pre-event would be quick and light, just getting everything to move. Deep tissue is going to involve relax your ankle. I'm going to take him through passive range of motion and pin and stretch, like that. And then I'm going to have him come up into my hand, come up as far as you can, and slowly relax. So that's active resistance. Okay. Come all the way down into the top of the foot, side of the foot where peroneals and tibialis anterior attach. Okay. Go ahead and work the plantar surface of the foot. This is a great position to do it in because I can use my body weight. I can have him plantar flex, which is to push your foot down. And then as he relaxes, I take him a little further. So this is also, we'll talk about PNF. Okay, so relax your foot. There you go. I'm going to take him into a stretch and I'm going to stop when I hit resistance or he tells me to stop. Okay, so just keep an eye on this angle. Okay, now plantar flex into my hand. 3, 2, 1, very slowly relax. You see how much the angle decreased? So we moved. That's PNF. Proprioceptive neuromuscular facilitation, PNF. PNF and pin and stretch are two of my favorite go-to massage techniques. I use them just about on a daily basis. Okay.